Thanks for joining me for this session of Discussions in Body Art. Visit newflowerstudio.com and take an anonymous survey to help me out. Thanks for being a listener. Your interest in my content is appreciated. This is only a partial version of this session. Patreon subscribers receive the full version, so if you'd like to hear more, please head to Patreon. At the time of this recording, I've been doing a lot of work with health inspectors, which always gives me ideas and inspires new content. I've also recently attended a sterilization conference hosted by the Southern California Sterile Processing Association. I did some great networking and learned a lot. It just takes me time to organize my thoughts and compose these sessions and make them suitable to record. Be aware that I've slowed down the uploading of content to these free distribution channels. I don't have plans to stop, but right now, Patreon is the priority. Friendly reminder, I'm not a healthcare professional or legal expert, and I have no formal education in public or environmental health. I have a lot of experience, though, and I encourage you to listen to Session 0 of this podcast to hear my introduction. Let me ask, when was the last time you used or heard the term chain of infection? Let's fix that. In body art safety, there's all these rules and concepts we memorize and apply to our practices to whatever degree is reasonable or necessary, and to the best of our ability. Studio owners have their responsibilities, and so do health inspectors, to understand safety concepts and their appropriate application to the body art environment. But if they're not practitioners themselves, actively working as body artists, it's got to be hard to really do much more than just memorize facts and figures. You can't learn to tattoo by only reading about tattooing. You have to really be doing it to put what you read into practice. It's the same with infection control and its many concepts and their place in body art. Let's add the term chain of infection to our body art lexicon. Chain of infection refers to the circumstances and series of events necessary for an infection to occur, and these factors must occur in a very specific order. Here's the good news, something you already know. A chain is only as strong as its weakest link, and removing only one link in this particular chain prevents disease transmission. Now, that might sound like an oversimplification. However, the more you've memorized this principle of infection control, the easier it is to apply it to the studio you work in, or maybe own or manage. And if you're a health inspector, the more effectively you can communicate with people in the facilities you visit. So once I'm finished with this session, you can go around talking about the chain of infection and sound like an infection prevention specialist. In this 6-link chain, we start with the presence of a pathogen. It could be bloodborne, so a studio's exposure control for bloodborne pathogens must be thorough and the staff must be diligent about preventing cross-contamination, and the concept of universal precautions must be understood and practiced by everyone equally. But a pathogen may also be airborne, which requires additional measures are taken. We all remember COVID, masks were important, and distance was important. Distance is not just a measure of space, but also of time. Shortening the amount of time we spend with possible exposure to airborne or bloodborne pathogens, the lower our probability of contracting them. The second link in the chain is a host, also called a reservoir, someone carrying the pathogen. Calling this a link is a little weird to me because I think of the presence of a pathogen, the first link, and the host as being kind of the same thing. If there's no pathogen, there wasn't a host. If there's no host, then there's no pathogen present. Some sources will tell you there's only 5 links in this chain of infection, which I agree with. However, the CDC cites 6 links, so that's what I'll go with for this session. The reservoir, the person spreading the pathogen in our body art studio themselves, was the unlucky recipient of disease transmission, which we'll get to again. Whether we're preventing a bloodborne or airborne pathogen transmission in our studios, we can't monitor who's entering and who's getting body art performed. That's out of our control in this context, but consider a few things. The higher the volume of people entering the facility, the more likely pathogens are going to enter too. And we generally don't know the health status of our clients without them volunteering that information. If you live in a state like I do, which requires us to specifically ask some health-related questions in our consent form, it's still self-verification, so we rely on honesty. And many people don't know their health status, especially in terms of bloodborne pathogens, which they can have and be asymptomatic and even undiagnosed. Take a medical environment for comparison. They're in the business of treating people who are sick, so the exposure healthcare providers experience is much higher. If you work in a clinic that provides healthcare services for HIV patients, you know that each of your patients is, or likely is, a host for HIV and can take all appropriate measures to prevent disease transmission. For body artists, managing bloodborne pathogens means applying universal precautions, sometimes called standard precautions. That means, basically, treating all human body fluids as if we know for a fact they're infectious. It's a little more complex than that description, but for this discussion, it'll work. This means practitioners know when to change gloves during a procedure, are performing hand hygiene before and after procedures, and any other time they may have had an exposure to body fluids or fluids that may contain blood, like tattoo ink. It also means properly disinfecting all relevant surfaces after a procedure. That also means, by extension, using the right types of products like disinfectants that are registered as tuberculocidal and not expired, and following the contact time as it's printed on the label. If the pathogen we're trying to prevent from spreading is airborne and not bloodborne, we should have good ventilation in our studios. That can include HEPA filters, which filter the air and are sold in different sizes relative to how much air they can cycle through in an hour. Don't forget routine housekeeping. Dusting is a super important part of infection prevention. Airborne pathogens like measles, influenza, and tuberculosis can all settle on hard surfaces like countertops and be aerosolized by air currents caused by people walking by and doors opening and closing. These pathogens can travel on dust particles that become airborne. COVID-19, by comparison, and influenza travel mostly by respiratory droplets people have exhaled, coughed, or sneezed out. Whether you think of the presence of a pathogen and a host as one link in the chain of infection or two separate links, someone entering a body art studio may or may not openly communicate their health status or may be or not be symptomatic with illness. When was the last time you were in a doctor or dentist's office? What was the experience like walking in? Were they offering masks? Was there any evidence of other possible safety measures, maybe antiseptic gels or signage with instruction? Were there barriers between staff and visitors? Are staff members keeping their distance when possible? The third link in this chain of infection is the portal of exit. A bloodborne pathogen won't exit the body by coughing or sneezing unless there's blood coming out. A respiratory pathogen exits the body through respiratory actions like coughing. A bloodborne pathogen exits the body through bleeding or any other body fluid which may contain that pathogen being expelled. Thanks for listening to Discussions in Body Art. I'm glad you've joined me. This is the halfway point of this session. You'll have to join me on Patreon to hear the rest. There's free blog content on Patreon too. I invite you to visit Discussions in Body Art on Patreon and subscribe at least at the free level.